Okay, Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. I'd like to thank you all for coming here. And let me introduce myself to you all. My name is Daffa Dhiyaulhaq. Okay, I'm from Emap Faculty Medicine 3. Now, I'd like to tell to you about my presentation. Today, I divided my presentation into three parts. The first is introduction, the second is the main idea, and the third is conclusion. And before going to my presentation, let's say basmalah together. Bismillahirrahmanirrahim. So I'd like to present to you our main topic about sleep and sleep disorder. Don't you know? Sleep is not just a time for a rest. It's a crucial part of staying healthy and feeling good. But sometimes things can go awry. Some people have trouble sleeping, and that's what we're here to explore today. And I think first we need to identify the topic. I will begin off by explaining the definition about sleep and sleep disorder. Again, the first about sleep. Sleep is a state of reduced mental and physical activity in which consciousness changes and certain sensory activities are inhibited. During sleep, there's a decrease in muscle activity and interaction with the surrounding environment, although sleep differs from wakefulness in terms of its ability to react to stimuli. Sleep still involves active brain patterns, making it more reactive than coma or impaired consciousness. And I think, and after that, I will be move on the next point about the benefit of sleep. Okay, getting enough sleep can play an important role in your weight, emotional well-being, blood pressure, diabetes, mental, physical performance, and more. Remember that adults are not the only ones who need a good sleep. It's also critical that children get even more sleep than adults. Okay, I will be talking about definition disorder. Definition of sleep disorder. Sleep disorder involve problems with the quality, timing, and amount of sleep, which result in daytime distress and impairment of in functioning. Sleep wake disorder often occur along with medical condition or other mental health condition such as depression, anxiety, or cognitive disorder. There are several different types of sleep-wake disorder, of which insomnia is the most common. Sleep disorder, wake disorder include obstructive apnea, parasomnia, narcolepsy, and restless leg syndrome. Okay, honestly, if you don't pay attention to our pattern of sleep, to sleep disorder, that perhaps one of you have this disorder, we will get into serious trouble. And soon first we have to know what are types of sleep disorder. Okay, the first is chronic insomnia. You have trouble falling asleep or staying asleep most night for at least 3 months and feel tired or irritable as a result. And the second is obstructive sleep apnea. You snore and have moments during sleep, and when you stop breathing, that disturb your sleep. And the third, restless leg syndrome. You have the urge, you have you have the urge of to move your legs when you rest, and you cannot regulate when you fall asleep or how long you stay awake. Okay, ladies and gentlemen, it's really important to know the causes of sleep. According to an article that I read recently, an internal book an internal body clock regulates your sleep cycle, controlling when you feel tired and ready for bed or refreshed and alert. This clock operates on a 24-hour cycle known as the circadian rhythm. After waking up from your sleep, you will become increasingly tired throughout the day. These feelings will peak in the evening, leading to uptime. Next, the causes of sleep. And let's move to the causes of sleep disorder. There are different causes for different sleep disorder, including other conditions such as heart disease, lung disease, nerve disorder, and pain, mental illness, including depression and anxiety, medicines, and genetics. There are also some factors that can contribute to sleep problems, including caffeine, alcohol, an irregular schedule, and aging. And it's really important to recognize how our sleep disorder diagnosed. A health care provider will diagnose a sleep disorder after physical exam to review your symptoms and testing. Tests can help your healthcare provider learn more about what's causing your symptoms like blood tests or imaging tests. They may ask you to keep a sleep diary. A sleep diary is a record of your sleeping habits. You will make note of when you go to bed, when you fall asleep, and when you wake up each day. You should also make note of any naps you took during the daytime and how you felt before and after sleeping. It helps to keep a pen and piece of paper near to your bed so you don't forget to write this item down. It can be difficult to know what time you fall asleep exactly, so you should estimate what time is it. You may choose to wear a smartwatch or a device that records your cycles of rest and activity. This can confirm what time you feel asleep and woke up. And after that, uh, I will move on to the next point. That's about how are sleep disorder treated. There are several types of treatment options available for various sleep disorder, which could include the first, changing your sleep routine to promote a regular sleep schedule and proper sleep hygiene. Cognitive behavioral therapy, taking medication, and changing medication or dosage that cause excessive sleepiness. And yeah, that's some tips how are sleep disorder treated. And let's move on the next point. What is the outlook for someone with a sleep disorder? Okay, sleep disorder can affect your overall health. You might not have the energy to do the things you want to do or even complete your daily routine. You may miss out on special moments or events because your sleep disorder prevented you from being fully present. In addition, you may put yourself and others at risk, especially if you drive or operate heavy machinery and aren't getting the rest you need to stay safe. If you're struggling to get quality sleep where you wake up feeling refreshed, talk to healthcare provider. Treatment is available to manage many sleep disorder and get you back to wellness. And I will be talking about the stage of sleep. Sleep occurs in five stages: the first wake, N1, N2, N3, and REM. Stages N1 and 2 and 3 are considered non-rapid eye movement sleep. which with each stage leading to progressively deeper sleep. Okay, uh, it's really important to know the risk factor for sleep disorder. Okay, to maintain our body from sleep disorder, to uh, to make to motivate ourselves to have a good sleep, better sleep, we have to know the risk factor for sleep disorder. Okay, although the cause can be caused by various factors, there are several risk factors that can be an impact for this condition, including the immune system becomes weak and gets sickly easily, such as fatigue, poor concentration, and chronic pain, and headache, and concentration decreases, increases the risk of accident, serious health problems, obesity, forgetfulness, affect skin health, increase the risk of death, increase irritability and irritability. And uh, and let's move to the next point. What is the healthy a healthy sleep pattern? Okay, maintaining a good sleep pattern can be one of the key to maintaining body health and productivity. Here's how to maintain a healthy pattern. The first, pay attention to sleep duration. Second, consistency of sleep schedule and quality. The third, avoid eating and drinking before bed. And fourth, create a comfortable sleeping environment. And the fifth, avoid playing on your cell phone before uh, before bed. Okay, this all my presentation from Team Emap 3 with main topic sleep and sleep disorder. Okay, uh, and in the last, let me summarize it to be some point in our presentation. Okay, we have learned about sleep is not just downtime, it's crucial for our health and vitality, and poor sleep affect our physical health, mood, and cognitive function, and practicing good sleep hygiene and lifestyle changes can promote better sleep. In short, understanding sleep disorder are essential for overall well-being. Thank you for your nice attention. I apologize if I had some mistakes on my presentation. Beloved, thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.